Is inappropriate affect a sign of psychosis? Have you ever seen someone laugh at a sad moment or show anger without a clear reason? This is known as inappropriate affect, and it can be quite puzzling. Inappropriate affect refers to emotional expressions that do not match the situation or the person's true feelings. For instance, a person might smile during a serious conversation or express sadness in a joyful setting. This symptom can appear in various forms, including facial expressions, tone of voice, and overall behavior that seems disconnected from reality. Now, when we talk about schizophrenia, inappropriate affect is indeed linked to psychosis. In fact, it is often grouped with other symptoms like bizarre behavior and disorganized thinking. These symptoms are characteristic of the psychotic process. Research shows that inappropriate affect is part of what is called a disorganization factor in schizophrenia. This means it relates to the positive symptoms of psychosis, such as thought disorder and unusual behaviors. Inappropriate affect can also coexist with other emotional symptoms. One of these is known as flat affect. Flat affect is where a person shows very little emotional expression, even in situations that would normally provoke strong feelings. While inappropriate affect is about mismatched emotions, flat affect indicates a significant reduction or absence of emotional expression. Both symptoms can be observed in individuals with schizophrenia and can affect their social interactions and overall quality of life. It is also important to note that medications used to treat psychotic disorders can influence emotional responses. Sometimes, these medications may blunt emotional expressions, making it harder to gauge a person's true feelings. However, the presence of inappropriate affect usually points to deeper disruptions in brain function and emotional regulation associated with psychosis. In summary, inappropriate affect is a sign that emotional responses are not aligned with the situation. In schizophrenia, it is linked to psychosis, particularly disorganized behavior and thought. This symptom is distinct from flat affect, which shows a reduction in emotional expression. Both inappropriate and flat affect are significant symptoms that can impact how individuals relate to others. Proper diagnosis and treatment by mental health professionals are essential for managing these symptoms effectively. Understanding inappropriate affect in the context of schizophrenia helps clarify how emotional processing can be altered in psychosis.